Good afternoon. I should like to express my particular thanks to OMIC Group for who invited me to attending this Congress. My presentation is quite different because I'm a family doctor, and I'll present you a little speech about the other side of the fight against viruses. The vaccination, the mass vaccination against flu. So, I'm the president of a little organization of medical doctors in my region, in the northeast of Italy. We are improving the communication about the vaccination towards vaccinal campaigns. It's an experience in a rural area of our region, in the field of primary health care. We are working to build a local e-network to keep both doctors and patients informed. Informed about infectious disease at all, especially about flu spreads, and flu vaccines. All starts many years ago at the time of SARS contagion, when emerged the need to improve the information provided by the public health service. And so some of the doctors operating in the territory, especially in rural areas, have decided to use internet to rapidly exchange information about possible clinical cases in our area. Then SARS dispatch became a sort of tool to communicate among physicians and with patients. Now is being addressed to about 106 doctors out of 1,300 around all the regional area. Aim of the project is to optimize the number of vaccinated people in a specific area of Bassa Friulana. It's the area of our region close to the seaside. This aim is still complex because in our country, family doctors do not have an organized structure and rather perform a work still based on the principle of expectancy with a limited space for initiative. We can say that we are overwhelmed by the patients. The vaccination against influenza is now free and voluntary for patients over 65 years old, all the people involved in essential services, people suffering from serious pathologies. Then, in the fall of 2014, in Italy, it occurred a press campaign after some deaths among elder people. They had been vaccinated against influenza 1 or 2 days before. The rate of vaccinated patients fell in Friuli Venezia Giulia compared to other regions of Italy. So we are trying to improve the rate of vaccination. I prearranged the communication via email to the interested patients and to the other doctors. to improve the quality of the information about the characteristics, dates, and methods, to increase the number of 65 years old patients who agree on taking the vaccination, and to have enough available vaccine to meet the request of patients. Methods. We are two kinds of methods. Common methods, posters and leaflets provided by primary care trusts. Information papers reporting the dates of vaccination session in my office. And innovative methods, innovative for Italy, of course. Email communication sent to 368 out of 1,425 patients of my office were provided with an internet connection. 3 emails have been sent. One advance notice emails a month before the effective beginning of the vaccination campaign. 2 emails confirming the beginning of the campaign, including the dates of the first sessions, 6 sessions during the month of November. 3 emails reporting about later dates and including information about the end of the vaccination session within the 22nd of December, 4 to 6 future available dates. I started as a family doctor, expert in infectious disease, and as the president of the local medical cultural association, Croce Medica. So I deal with 2 aspects, the patients and the colleagues. Patients with communication information about the vaccination available in my office and in the office of the other colleagues that reached me in this adventure. The colleagues with information about the vaccination against influenza, updates on its forms, and other infectious diseases related to the activity of family doctors. To increase the spread of a vaccination, the emails remind patients about the vaccination dates, as well as they promote a new way to contact the family doctor and to receive more information about the vaccination. The information by emails has also facilitated the patient's self-organization, especially to reach my office. To have enough available vaccine in Italy is provided by the national health system. But we have to make some pressure to have enough. Personally reserving the vaccine dose in the doctor's office, constantly having the situation under control, asking for the vaccine doses realistically corresponding to the patient's request, being able to guarantee vaccination to all the entitled people, reducing wastefulness. A local network to keep doctors informed. The association dispatching is SARS sent to more than 100 doctors is trying to remind to our doctors the importance of influenza virus and of the vaccination. And sometimes it's about other epidemic disease which might concern also Friuli-Venezia Giulia, such as West Nile virus and chikungunya virus. Recently about Ebola virus. But the information feedback was negative. Unfortunately, the information feedback is still scarce. It's still limited to an average of 4 out of 106 doctors who send information in relation to each yearly issue. And we have another kind of problem. The most of health workers try every year to avoid the vaccine against flu. There has been a small increase recently in the participation in the vaccination campaign against influenza. This outcome might be interpreted in several ways. According to the improvement of the communication, other factors, I don't know now. In the vaccination campaign of the years 2012 and 2013, vaccinated people over 65 years old was 55.7%. And then 66, just a little improvement in the local rate. For local rate, as a local rate, we'll say the rate in the area near the seaside where our association has the most part of his doctors. And the last year, the local rate falls while the press campaign was running. 53.09, but it is important, the regional rate was significantly low, 48. And so, thank you for the patience. Greetings.